Okay, 35 years old, BMI 25 with no periods for 13 months. She is diabetic. And which risk factor in her can predispose to endometrial carcinoma? We have different options like diabetes, early menopause, premature ovarian failure, and obesity. The answer of this is D, obesity. Now another question, a 62 years old woman undergoes a CT examination of the left leg and a 4 centimeter simple adnexal mass is seen in a patient right side. The patient went through the natural menopause at the age 50 and had no other complaint. Which of the following is the most appropriate management of this radiographic finding? Exploratory laparotomy, diagnostic laparoscopy, 1 year's measurement of CA125, BRCA 1 or 2 testing, and ultrasound evaluation at the 4 month along with the CA125. The answer of this question is C, that is 1 year measurement of CA125. Now another question, a 26 years old patient taking treatment for assisted reproduction came to ER with a pain in abdomen. Okay, there is a right adnexal tenderness and beta HCG was positive with no intrauterine pregnancy. Which of the following is the most probable diagnosis? Beta HCG is positive, right adnexal tenderness, no intrauterine pregnancy. The diagnosis is, we have options like ectopic ovarian hyperstimulation, ovarian cyst torsion. So in that case, I would say that A is the answer, ectopic. Another question, a pregnant lady came with 10 into 12 centimeter mass with a solid and cystic component. C125 is normal. Which of the following is the most likely diagnosis? Dysterminoma, dermoid, epithelial tumor, and stromal tumor, and endometrioma. Okay, C125 is normal, but it is solid and cystic. So my answer would that be dysterminoma. Answer is A. Most common tumor is dermoid. Most malignant is dysterminoma. Now coming to another question, mesothelioma of the ovary is also called thelioma. Refers to some side of some sort of epithelium. We have different options like endodermal sinus tumor, Brenner tumor, clear cell carcinoma, serous cystadenoid epithelial tumor. So mesothelioma. So my answer would be E. Now there is another question, 35 years old patient with PCOS with a pap smear showing glandular cells, suspicion of endometrial origin. Okay, now we have different options like cone biopsy, colposcopy, hysteroscopy and biopsy, and reassure. The answer of this question is D, that is reassurance. Okay, now what is the reason behind it? Okay, in case of the young patient with a glandular cell, we just have to reassure, but this is not normal in case of the old postmenopausal lady. In case of the old postmenopausal patient above 40, if we see glandular cell, pap cells showing the glandular cell, we have to do hysteroscopy and biopsy. Okay, now another question is about percentage of cervical cancer in high risk group. Different percentages are given like 50 to 60%, 65 to 70%, 80 to 90%. So the answer would that be B, which is 65 to 70%. Okay, patient came with repeated vaginal discharge due to cervical ectopy, unresponsive to medical treatment. What to do next? Conization, cryocautery, and antibiotic. In that case, the cryocautery would be the better option. So answer is B. Now another question, a patient had vaginal hysterectomy. She got injury to the lower urinary tract along with the vagina and presented with persistent urinary leaking, and there is no urgency or dysuria, and MSU is normal. And how to confirm diagnosis? Okay, we have different options like IVU, cystometry, cystourethropy, 3 swab test, and culture and sensitivity. The answer of this question is D, which is 3 swab test in order to diagnose the fistula. Now we have another question, 52 years old lady on her 12th post-op day after VH plus AP repair. Most likely complication would that be general stress incontinence, fistula, bleeding, urinary incontinence. As most likely complication is also my answer would that be bleeding. Okay, now there is another important thing that is with the same type of questions. If the patients with a VH comes and it is asked that what is the short-term complication, that is UAD, urinary retention, and if not short term, then genuine stress incontinence. And after TH, if complication is asked, then we should go for the fistula. So with the same options, there might be some sort of variations in the question, and we have to look in detail what sort of the question is asked in exam. So these are the few questions which we have discussed here. Okay, we will try to make some other videos for other questions. Thank you so much for your patience.